Well, I'm very uncomfortable with my smile. And I am not happy with my smile. That's basically what it is. I've been to a couple of job interviews where we were discussing my qualification, but I was more worried about them looking at my teeth and my mouth than my resume. I wasn't coming across very confident. At home, with my wife and my children, I do smile a lot, but outside, I don't. So I decided to do something about it. If they looked straight and wider than they do right now, I'll be a lot more confident and be happy and easier to smile. My name is Mehdi Dalshat. I'm 52 years old. I live in New York and I'm a professional pilot.
I'm Christine Scordellis. I'm a dentist here in New York City. I do aesthetic, cosmetic, minimally invasive dentistry. I've been practicing in New York for 16 years. I discovered the Componeers at a course in September of 2010, and I absolutely fell in love with them. I'm a composite placing doctor, and they're super easy to use. It is totally prefabricated. It's fantastic that you are able to have them in office. Componeers will require only one office visit, whether it's one Componeer or 6 Componeers. It would take a doctor approximately 30 minutes per tooth.
I have looked into different options. Looked at porcelain veneer, which is almost twice as expensive.
The difference between the Componeer and a porcelain veneer is, a porcelain veneer, you can't pull that thing off, you're gonna fracture it. And when you fracture a porcelain veneer, you need to take an impression and send it off to the laboratory, and then you're talking about lab time, and you're also talking about extreme cost. Whereas the Componeer is already made for you. It is a highly polished surface, and you can manipulate and change the shape of the tooth, but on the outside edges. And it's also very cost effective for the doctor and for the patient. How long will your Componeers last? It's normally approximately 8 to 10 years. However, I have patients who have composites that have lasted, at this point, 15 years. The Componeer is sandwiched with composite onto the tooth surface, so that should be pretty much an indefinite bond. If a patient chips a Componeer for some reason, it can be completely repaired and you're good to go, and you polish it up and you should be out the door in no time. And if it's like an incisal edge or even at the gum tissue, most times you don't even need to be anesthetized, and a lot of people really care about that. Mehdi, here is your new look.
It's awesome. Thank you.
Now you could really smile.
Oh yeah. I can't really describe it in words, but I'm extremely happy and excited. I feel great. It's been 3 hours. My bite is normal and no pain. For one thing, I'm sure I'm not gonna hide any smiles or any laughs. I love to laugh and smile, and I'm gonna do it a lot more often after this.
It gives people confidence, and it gives them courage. And it gives them the courage to be able to do what they want to do. And some people will not smile, they don't open themselves up because they're afraid to. And this gives them confidence, and that's huge. He's a new person.